listening to the Friday Five here on the Agent Survival Guide podcast. I'm your host, Sarah Ruppel, and this is our weekly list of 5 things you should know about. Today is Friday, May 8th. And earlier this week, my social feed was flooded with all sorts of interesting and somewhat on-theme ensembles from the Met Gala. But in other news, a federal court made the preliminary decision that Apple should pay for not delivering on AI tech featured when marketing iPhone 15 Pro models and all iPhone 16 models. For those of us who purchased these devices, the settlement amount starts out at $25 per device and could go as high as $95 per device, depending on how many people file for this claim. That affects me twice over with the purchase of my daughter's first iPhone, so we will be sure to keep an eye on this one and report back. Meta also announced plans to identify users under the age of 13 by using AI to analyze features like height and bone structure. It's a move that stems from a New Mexico court decision that Meta misled consumers about child safety on its platforms. And then also, more Meta news. DMs are coming to Threads on desktop and web versions. Previously, that feature was only available via the mobile app. Now you will be able to DM your Threads friends regardless of how you utilize the app. We have been talking quite a bit about prior authorization lately, and on Tuesday this week, CMS admin Dr. Oz gave an update entitled Moving Prior Authorization into the 21st Century. The article reiterates much of what we've been talking about in the past week, highlighting what CMS is doing and their thought process behind it. There's another call to axe the facts and kill the clipboard, but there are also some interesting stats Dr. Oz shared. The cost of prior authorizations can range from $20 to $50 per hour and can take up to 13 hours a week for an average of, quote, $34,000 and 700 hours a year per healthcare provider, end quote. Dr. Oz talks about the next part of the path for prior authorization reform, bringing it to health systems, hospitals, physician practices, electronic healthcare vendors, and digital health developers. Another figure mentioned by Dr. Oz in reference to CMS prior auth policy changes set to go live on January 1st, 2027, quote, these policies will reduce burden on patients, healthcare providers, and payers, saving approximately $15 billion over 10 years, end quote. If you would like to learn more and get caught up on all things prior auth, we will be linking to a few resources in the notes, as well as a link to Dr. Oz's blog post. If you listen to sleep music or sleep sounds to aid you in falling asleep, you are not alone. It is a huge market, one that in 2024 brought in $2.4 billion. And according to a recent sleep audio market study, the market could grow by another 15% by 2033. Forbes is currently in the middle of reporting on all things sleep, and their piece on the increasing popularity of audio sleep aids had some interesting reporting in it. When my daughter was younger, we used Goodnight World, the sleep podcast collaboration between Headspace and Sesame Street, to transition from story time to sleep. That is something we have mentioned here previously on the podcast, and that habit has morphed into sleep sounds as she has gotten older. In the Forbes write-up, they talk about the ideal BPM for a song to soothe you to sleep, 60 to 80 beats per minute. And usually wordless tones are the most universally popular sounds. And even on Spotify, A recent study from Sleep Play identified dark ambient noise as the most popular sleep playlist genre. I don't know if it's the Pisces in me, but I have a preference for rain, thunderstorms, and ocean waves. In a recently released brief, the Centers for Disease Control reported that 30.5% of Americans slept for less than 7 hours on average in a 24-hour period. If you happen to be in that percentage, or you have trouble falling asleep regularly, we will have the link to that Forbes article that mentions those different sleep audio options. We will also have the link to a sleep playlist we put together with individual tracks and podcasts linked, so you can easily identify them and then listen to them or find them on the platforms where you like to listen. I also threw in some other favorites that we have and have not mentioned here on the podcast before, just to round out the selection in that playlist. Good sleep is super important, especially as we are heading into the fun of the summer season and the frenzy of AEP prep. On Thursday last week, after we had already finalized our Friday 5, Cigna made the announcement that they plan to exit the ACA market for the upcoming coverage year 2027. According to Brian Evanko, COO at Cigna, quote, "We did not make this decision lightly and appreciate the importance of ensuring patients have continuity through transition," end quote. Evanko also talked about the challenges currently facing the healthcare industry and where Cigna plans to focus their efforts moving forward. The problems that we see really are threefold. The first one is affordability. The second one is, at times, there are fragmented customer and patient experiences. The third one is we have a reactive sick care system. So our strategy at the Cigna Group is focused on addressing each of these opportunities, end quote. After the announcement, shares of Cigna dropped, despite the fact that the carrier's ACA portfolio makes up just 2% of its overall member base. Cigna currently offers ACA plans in 11 states: Arizona, Colorado, Florida, Georgia, Illinois, Indiana, Mississippi, North Carolina, Tennessee, Texas, and Virginia. One sign that we are getting closer to certification season has arrived: the official dates for the 2027 AHIP certification. Every summer, we have a very small window of time when AHIP certification is unavailable as the organization makes the switch from one plan year to the next. This transition typically happens over the course of one weekend, so not too long of a period of time, but something you want to make note of. This year, the 2026 version of AHIP certification will come down on Thursday, June 18th at 11:59 p.m. Eastern Time. Training will remain offline and unavailable from Friday, June 19th through Sunday, June 21st. AHIP's 2027 plan year certification will go live on Monday, June 22nd. No specific time for that launch to go live just yet. That is usually sometime in the morning, but the site will come back at some point on that day. Once the training is live, you can get that out of the way and get on to the next step of preparing for coverage year 2027. Word has it that NABIP certification for 2027 will also go live on the same day, Monday, June 22nd. So mark your calendars and follow along with our show to stay updated on what's going on in the lead up to enrollment season 2027. We will have the details on certification, carrier trainings, all that good stuff, as well as when you should be prioritizing those steps with our quarterly calendar episodes. But for now, thanks for taking the time to listen to this week's Friday 5. If you have a shout out you'd like us to make here on the show, reach out via our email, asgpodcast@ritterim.com. We shout out birthdays, anniversaries, retirement, all of those fun milestones that are worth celebrating. Have a great weekend. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Emily Ryan. Podcast design by Urban Rivera. Like what you hear? Follow along with our show wherever you get your podcasts.